EMDR is a very helpful trauma treatment. Eye movement desensitization reprocessing is a particular kind of therapy that was invented by a woman, Elaine Shapiro, who was walking actually and noticed that when she put one foot down and the other foot down in that back and forth movement and thinking about things, she was able to process things in a different way. And then we recognized that when we dream with that REM sleep, the eyes going back and forth, we are also processing information and memories and connecting the two sides of our brain. So when we do EMDR now, as therapists, we have beeps that go back and forth, or music that goes from one side to the other, or these little handheld vibrating things that go bzz, 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 one side to the other. So it's really that bilateral stimulation that will help connect the two sides of your brain and can retrain your brain to process these memories that are stuck basically in the alarm system part of your brain. So the amygdala is the emotional part of your brain and also is basically like, pull the fire alarm, danger, time to run, time to have fight or flight or freeze reaction. And so when we have a traumatic memory from childhood, we will often hold that memory in the amygdala, and then that can be triggered by anything that kind of reminds us, even if we're not consciously aware, things can remind us of that old trauma. And that part of our brain is built to keep us safe and therefore pull that fire alarm anytime there's something that might remind us in some way of that old trauma. And then we'll have that reaction. Our nervous system will get totally triggered and we'll feel that heart rate racing and intense panic and those kinds of things. So here is a very simple rendition of our brain's system that is really built to keep us alive and built to scan the environment for danger and to learn what's dangerous. So the amygdala is this alarm system where you've heard of the word trigger, where people get triggered with things that remind them of the trauma that happened. So something that might have something to do with a trauma. Let's say there was a Vietnam vet, for example, who had a lot of danger, a lot of trauma that was very life threatening, and heard gunshots and dove under anywhere to get protection. And then that sound of a loud noise like that gets stored here as there's danger, get the alarm system going. And so now when there's a door slam or a car backfiring, that will fire. And so with EMDR, we have been able to move those awarenesses, those learnings, the traumas into the hippocampus, which is the normal memory part of your brain, so that those triggers are no longer going to set off the alarm system. And you often during EMDR will remember even more details about the trauma, but the emotional reaction will reduce as the two sides of the brain connect and as the memories move from the amygdala to the hippocampus. And so it's really powerful to be able to reduce those triggers and retrain your brain that these things that were associated with the trauma might not be dangerous anymore. In addition to the brain changing the way the memory is stored, often the memory itself will change. And it's almost a way to time travel or to change the history and the timeline, because memories are imperfect and they are based on perception and beliefs. And when we do this EMDR, your brain will often naturally recreate the story or change the perception. If you were a child and it felt really big and scary, sometimes when you go back and review the memory with EMDR, you will see it all from the outside and see that you were just a little child, and then the belief that it was your fault or that you had some responsibility would change. Another thing that happens naturally often is a magical intervention. So sometimes someone will just fly away from the situation into the sky. And you can invite something like that to happen as well. You can intend once you've processed a lot of the trauma, to go back and rewrite what happened, or even bring your adult self to go back and confront somebody who treated your child self badly, or have your adult self talk to your child self and tell them, hey, you made it through that. You're okay. Everything's going to be all right. So there's a really incredible way to actually rewrite that story and change the way that trauma impacted your development and the rest of your life and your perception of people or perception of yourself. And as you rewrite that old memory, that can kind of flow through your entire development to the here and now. And so there really is this magical possibility with this work as well that will help to really shift the way you walk through your life today. So I definitely encourage you to find a therapist who is certified in EMDR and work with them if you have trauma.